Hello, doctor. I'm so happy to have you here today. So you have a great topic today, which is hair loss consultation best practices. We can wait to know more. Thank you once again. You can start.
Hello, Lisa. Thank you for inviting me again for the lecture. I'm very happy to share my knowledge and experience with SkillMed Institute. So today I'm going to talk about hair loss consultation. So I'm Dr. Wipawan Vathananai, and I'm a hair transplant surgeon based in Bangkok, Thailand. And before I started learning hair transplant, I studied dermatology before. So basically now I'm dealing with mostly the hair transplant cases, but I also still go to the Institute of Dermatology as a consultant. So today outline, I'm going to talk about how to prepare for the consultation and step-by-step guide for doctors or trichologists that they might not be as experienced as I am in dealing with the patients, and also how to give a personalized treatment for the patients. I'm not going to go into details about each diseases since I think some of the lectures have already covered about that. So let's start. So the importance of doing consultations, especially in hair diseases or even hair transplantation, is building the trust. As we know, like nowadays, there are so many patients that they might threaten to sue or threaten to give a bad reviews on Google or any online channels. And that's very scary for everyone like us that we do business on hair transplant or clinic, because once there's a complaint in public, it's very difficult to erase that. So I think a good consultation, which can provide trust, and a good doctor patient relationship will be able to prevent that kind of situation. And it's also very important to create the right expectation in the patient's mind, because in hair loss, not every patient will be able to gain the full head of hair. So it's very important that you must assess the patient's mindset. So, how to prepare for the consultation? So, in my opinion, we need a private space, and comfortable. And also, mostly, I would need at least 15 to 20 minutes during the first consultation. And also, in case when the clinical changes, like when it gets worse or anything doesn't go like the way the patients expect, that's when we have to spend more time explaining or trying to find the cause of why the hair loss condition is getting worse. So usually I would recommend around 20 to 30 minutes. That would be quite reasonable in my opinion, because you will need to take history. You'll need to assess how hair loss affect the patient psychologically too, because I've been, especially in men with androgenetic alopecia, I mean, lots of them actually have mental problem because they lost the confidence in living their lives, especially people that they are in their 30s. It's the age that, you know, you go out dating, you go out with friends, and when you don't have hair, it kind of really affects the self-confidence. So I think that's very important to spend the time. And the tool that I highly recommend that everyone should have for the first consultation and also the follow-up is the photography. I mean, the best would be digital camera. I personally use Sony A Alpha 6000. Um, I don't really recommend the kid's lens if you would like to take it for the hair transplant result, because it doesn't provide enough resolution. But as long as it's a digital camera, I think it's really good. Make sure that it doesn't